and all the really cool magazines out there. So we needed Ali's help there.
I heard the Pure Clinic is going to set me up with a personal trainer so I can get back in shape.
Awesome. That's good. You're going to train for, we're going to LA next year.
I got
You're going to train with us. I think we're going to need 3 drivers.
Oh, did you?
Sure. All right, we're in St. Augustine. Hello, St. Augustine. We're going to get started. Dr. P and Ali Kazrayan.
All right, so we have Dr. Ali Kazrayan here from Kazrayan Neurology. He's one of the premier robotic surgeons in the world, done some specialized fellowship training. And he's going to talk to us today about some new diagnostic modalities and some new options in prostate cancer.
So I'll tell you, Cesar, thank you very much for one, doing this for Men's Health. It's an amazing event that allows us to raise awareness. Cancer, specifically, men being aware of what's out there is very important because we're in an era of personalizing care, and that personalization starts with being aware of why to screen, why not to screen. There's a lot of controversies out there for prostate cancer screening. So my recommendations are you can look at the data, start screening at 45. PSA rectal exam. There's still evidence all over the literature that shows that PSA screening, since its inception in the early 90s, saved lives. Prostate cancer specific mortality is down by 40% or more in the screening era. And they've actually done predictive modeling that if we stop screening based on the recommendations for against screening, by 2050, more than 76,000 men will die every year of prostate cancer. So I think screening still saves lives. Right now, even with our aggressive screening protocol, 28,000 men die per year. So how can we do better? We can do better imaging. There's a lot of data out there that shows multi-parametric MRI that you focus to the prostate can target lesions. So when you do the biopsy, you biopsy targeted lesions and you don't miss anything and you catch significant cancer. We in our clinic this year teamed up with Invivo to bring a multi-parametric fusion platform to Jacksonville, Florida, and working with our colleagues in precision imaging that gives you a very good MRI scan. You do the technology where you can fuse the MRI. Much like what we do with breast cancer. No one goes and randomly biopsies the breast. You have a mammogram, you have a lesion, you biopsy. So then the next question comes, what do we do with the biopsy results? Historically, we have a Gleason score, where we look at the stage and the grade of the cancer and see whether cancer is low risk or high risk or intermediate risk. Now we can use genomics. We can look at the genetic signature of an individual person's cancer and figure out, is their cancer more aggressive or less aggressive than predicted? And based on that, we can have a personalized intelligent discussion about what with your personal prostate cancer, much like we do with breast cancer. Right now, when people get breast cancer, check siblings. Better. So right now with breast cancer, what we're doing is at diagnosis, you have the entire genetic signature and the prognosticating factors that you can make decisions on what to do with the breast cancer. That's really important with prostate cancer. So we can now do a targeted biopsy, find the cancer that's significant, see how aggressive it is, and look at the genetic signature of that, and then give personalized recommendations. Active surveillance for cancer for low risk, not as aggressive as the active surveillance on. Cancers that are warrant treatment. We can now do things like focal therapy, using technologies like high intensity focal ultrasound or HIFU, or use sound waves and ultrasound. You can go and focus the treatment at the tumor, much like the lumpectomy. So all these things allow us to be more personalized with the delivery care for prostate cancer so that we decrease the morbidity. My good friend Dave Field, who is a robotic surgeon at my clinic, always says if you took erectile dysfunction out of the morbidity picture for prostate cancer, a lot more people would have a prostatectomy to get rid of their cancer because of their fear of not having to treat it. And I know Dr. Brody is going to come on and talk about survivorship of prostate cancer with erectile dysfunction, rehabilitation protocols, and that. So I think, Men's Health Week, I think one thing to take home with them, regardless of what disease we're talking about, is get checked. Catching things early, getting screened, allow us to catch the cancers, the tumors, the medical problems at a point where we can intervene and have less side effects and more minimally invasive options, which I know your career is based on the most minimally invasive options. And with prostate cancer, fortunately, we can potentially be non-invasive.
So for guys out there, what should they do? I mean, what do you
tell you a couple things. You know, guys, we need to take accountability for our own health care. 36%, 35 to 36 of men above the age of 20 are obese. You know, that marries with diabetes, with heart disease, you know, things of that nature. So take accountability for your own health. Eat well. Have healthy weights. Make sure you exercise. Go see your doctor. You know, specifically with prostate cancer, be intelligent about screening. They did a really elegant study out of Malmo, Sweden. The guys in Memorial Sloan Kettering looked at 21,000 guys, followed them for their entire life, and went back and looked at blood samples in the freezer from them when they were younger. The first PSA of 45, they found that if it's greater than 1, your risk of prostate cancer is higher than if it's less than 1. So you can personalize your screening. So don't throw the baby out with the bathwater. Personalize your testing. Get screened earlier and more often. If you're a Caucasian male without family history, start at 45. See what your PSA is. If it's less than 1, maybe every couple of years. If it's greater than 1, be a little bit more aggressive. And don't forget the rectal exam. I know it's not people's favorite, but you can't have prostate cancer with a low PSA and a man.
And Ali, I know you've done some amazing stuff, and you have your own radio show, right?
I do. And I'll tell you, the same frustrations you've had for men not taking care of themselves prompted the radio show. You know, one, I think physicians sometimes are vilified. And so I think doing things like this and getting us out there as our patients' advocates and the advocates for our profession and our health allow us to have very cool conversations and really get back to what we all went to med school for taking care of our patients and keeping them healthy.
And any parting advice, anything that you want the guys out there to take away from this?
Get checked out, you know, specifically with prostate cancer. If you're approaching 45, get a PSA, get a rectal exam. You know, and if you have any questions, that aren't answered, see a urologist. Our urologists sometimes have a little bit different take on prostate cancer screening than general practitioners would and things like that. You know, the gains we've made at decreasing prostate cancer mortality by more than 40% are all going to go away if we stop screening completely. So I think we have to screen more intelligently. We have to treat only the cancers that we need and actively surveil and monitor the ones that we can. And then think about focal therapy and things of that nature to be better at both diagnosis and treatment. Again, I think the world's changing towards an era of personalized medicine, and I know your practice is very much key to the personalizing care for the patient, and that patient's one at a time. And it's that challenging now in terms of all the global healthcare comments. As a patient, go get checked out. All of us are going to be patients. All of us are men. We're stubborn. We don't go to the doctor. Please go to the doctor. And if you care about a man and a significant other, your brother, sister, wife, take your significant other, take your brother, take your dad, take your grandfather, get them to the doctor, get them screened.
Well, Ali, thank you so much.
Oh, thank you very much.
Yeah,
Appreciate it. Thank you for getting me. You guys block your time, come back on the show.
Absolutely. Thank you so much.
My pleasure.
Thank you
My
very
pleasure.
So, parking.
much. You want to introduce Dr. Goldberg?
Yeah.
Do you want to do that? Or? So again, thank you guys. Thank you everyone for being online. And I'm going to have Dr. Broderick up next. He's a global expert and leader in erectile dysfunction. He's going to talk about erectile dysfunction.
That last Tesla, he wants us to get him ready. I think we're ready.
So it's an amazing view out here. You can see all the cars charging out here. What a sight. So you have 1, 2, 3, 4, 5, 6. What started as a small idea has really kind of grown, and hopefully we'll keep this growing. So, so Tesla, we need more supercharging stations because next year we're trying to get 10 or 12 of these beauties out here. And so, just a heads up to Elon. Please get more Tesla supercharging stations.
Really great. Yeah.
Working?
Yeah, still working.
Well, why don't we keep talking here? Okay. We're waiting for Dr. Broderick.
You're on mic, so I need to be mic. How's the drive?
So tell us about your tell us about your radio show.
So our radio show is it's called The Conversation. You can check it out on at www.theconversationjax.com, on Facebook, The Conversation Jax, Twitter handle at The Conversation Jax.
He's interviewing someone. You get to see all the inner workings for our live broadcast.
So, and you guys were on a couple of weeks ago, so you can actually listen to the show with Dr. Brownbed and Dr. Pericato on our podcast that you can get on the website. And basically, we talk about health. We talk about healthcare politics. We talk about men's health. We talk about women's health, and it's a very fun thing to do. This week, we're actually talking about the VA controversy. So I have an expert that writes. We're going to be talking about that this week, so it should be interesting.
Yeah, there's a lot of controversies in healthcare, and these controversies have led to some of the hesitancy that people have in going to see a doctor. But we're trying to change that. We're trying to educate people, as you can see here, that it's okay. So now we have Dr. Broderick from the Mayo Clinic, who we're going to be talking to now. Dr. Broderick, can we get a mic for Dr. Broderick? Okay, there we go.
What was this question? Great.
So, is it on?
Yeah, let's get a test on my mic. A sound check.
Do you have handheld mics, or is all you have? So, Dr. Broderick, nice to see you. We are here in St. Augustine, Florida, which is stop number 2 after our stop in Claremont. And Dr. Broderick comes to us from the Mayo Clinic. Thank you so much for taking time out of your busy schedule to be here. And today we're going to be talking a little bit about erectile dysfunction.
I'd like to talk about a Tesla and whether I can get one, but if you want to talk about erectile dysfunction, we can do that too.
Broderick, hold on 1 second. We're having mic issues here, so it's okay. Okay, there you go.
All right. I'm pleased to be here. A lot of people don't know this, but this Tesla charging station is just 15 minutes south of my office in Mayo Clinic, Florida. Mayo Clinic, Florida just celebrated its 27th year in the state of Florida. And my specialty is men's health. In Europe, they call that andrology. What it basically I've been long trained to deal with cancers and general urology problems. In the last 15 years, though, I've developed a specialty interest in managing men, and specifically managing those men who are cancer survivors. Men like you and men like me who are in the middle of their lives, the most productive years of their lives, and unfortunately have to deal with cancer, have to have radiation treatments, or have to have surgery. They recover from that. They get back to work. They become the head of household, but the relationship between them and their wives is not the same. So there's a significant amount of erectile dysfunction caused by cancer surgery and radiotherapy treatments for cancer. That's where I come.
So tell us a little about erectile dysfunction. Like, we've been doing a lot of radio and TV, and that's the first question that we get asked is, oh, my husband has erectile dysfunction. Can you tell us a little bit about, how it is caused? I know you mentioned surgery can cause it, but what about non-surgical causes?
The majority of patients that actually have ED because their cardiovascular system is not what it used to be. The majority of men that suffer with erectile dysfunction have ED because they have cancer, hepatic cancer. But they have erectile dysfunction simply because they develop. The majority of don't have cancer. They haven't had a treatment. They have erectile dysfunction. Well, erectile dysfunction is generally caused by a hardening of the arteries or narrowing of the arteries that supply blood flow to the penis. The erection is what we call a neurovascular event. So a man becomes sexually stimulated. That stimulation is transmitted by nerves down to the penis. The arteries in the penis dilate and fill the penis with blood. The final step is for the valves of the penis to close and generate all of that pressure in the penis to maintain erectile rigidity. So as we age, there can be changes. The primary changes are men find it more difficult to initiate erection. Others may find it difficult to maintain erection. And then eventually men come in with the inability to keep erection. So the workup for ED is very similar to the workup for cardiovascular and heart disease. I want to know cholesterol. I want to know what you have hypertension, whether that's being treated. And I want to know whether your father has heart disease. The testing is also very simple. I use a technology called Doppler ultrasound, which is a non-invasive way of evaluating penile arteries.
Dr. Broderick, another question we often get asked is what are some of the treatment options for erectile dysfunction? I know there's some surgeries we can do, some medications we can give patients, and really the question usually is there hope for my partner? Is there hope for me? You know, can I get my erection back? I was a lot, yeah.
Well, I've been in the business for quite a few years, and I can actually remember the introduction of Viagra in 1998. Prior to that time, the majority of patients suffered with erectile dysfunction for a minimum of 5 years before they would come into the office. Men are not tolerant of that anymore. They want a real quick fix. So the majority of patients coming into me know that they have ED and know that Viagra, the D4MH are available. So our first discussion is whether or not those drugs might be right for them and safe for them. Second discussion is sometimes, oh, by the way, I tried my buddy's Viagra and it didn't work. Why didn't it work for me? So that's a more involved discussion and a more involved evaluation.
So, Dr. Broderick, I know some of the other there's back erection devices, and there's also the support. Do you do penile prosthesis?
I do penile implants, and I've done penile implants for more than 20 years. They're an excellent way of restoring a man's sexual health. They should be considered a resort, a last resort, because it is an invasive surgery. There are some risks associated. Risk of infection and the risk of device malfunction. By and large, the patients that we see these days can be treated with tablets. Tablets commonly known as Viagra, the D4MH. The classification is something called a phosphovascular inhibitor. With them, and their spouses are very happy with the responses. So for those 30% of men that do fail, we do have to explore other options. Among those options, as you've mentioned, are there's a device known as the vacuum erection device, and for those patients that are appropriate candidates, there's the penile implant surgery you mentioned.
Dr. Broderick, if you had something just general to tell all men out there, not specific.
Well, the first thing I tell you is it's good that you read the newspaper and you watch the news, but that's not where you should get your health care. You should get your health care at a physician's office. And like your wife, who goes in for annual checkups, you should go in for annual checkups. This is the one's going to New York. You can't have this in New York.
Hello? Okay.
Okay, we've gone.
Sorry about that. Dr. Braun, let's give a round of applause for our soft break through the mics. With us. Thank you so much for being patient.
All right, we've gone prehistoric on the electronics today. Hopefully the cars are charging up better than the mics are. Okay, so the question was again, what are the options for men who have erectile dysfunction? The common options are Viagra, Levitra, Cialis. There's a new product called Stendra. And each of these tablets is known as a phosphodiesterase type 5 inhibitor. Helps promote erection. And it gives you a natural erection. You must be sexually excited. You won't get an erection. Don't be embarrassed. It has to be with sexual stimulation with your partner. Now, 70% of men respond to those tablets. 30% of men don't respond to those tablets because there's something more profound going on, and they should have an evaluation. So I think this conversation about sexual health begins in the primary care doctor's office, along with conversations about, should I have a colonoscopy? Should I have a prostate exam? Should I have a blood test for prostate cancer? My dad had prostate cancer. My dad needed surgery because he couldn't pee as he got older. Is that going to happen to me? We're all very smart. We can open up Google and search a lot of health topics, but that's not going to provide you with personalized medicine. Personalized medicine starts with your physician, someone who's trained to recognize problems in men's health. And that's why we're here today, to talk about men's health.
Well, thank you so much, Dr. Broderick. Dr. Broderick comes to us once again from the Mayo Clinic. He is an expert on men's health as well as erectile dysfunction. And thank you so much for joining us today. And we hope you will continue to follow us on our live webcast at driveformenshealth.com on YouTube, Instagram, and Facebook at Drive4Men, as well as Facebook blog. And we're doing a lot of great things. At this time, I'd like to take a moment to thank all of our sponsors. You can go online and see all our sponsors are. Also like to thank our title sponsor, Genomic Health, as well as our supercharged sponsors, South Lake Hospital, Hitachi, Da Vinci, Irby, VTI, and Percuvision. So thank you guys so much. We're going to log off our live broadcast here for a few minutes, and then we'll get back on when we're on the road. Do you know where we're going from here, Dr. Broderick?
You're going north.
Where's that?
Where's the next stop?
We're going to Savannah, Georgia. We will see you in about 2 hours. And I want to thank our entire team. Ben, can you show everyone all the different cars that are here? I think we got, how many Teslas are charging right now? 1, 2, 3, 4, 5, 6 Teslas are charging right now. And once again, the Tesla is a great car, and we're using the Tesla to break down barriers with men. We want to get men talking, just like we are today talking with Dr. Broderick. Dr. Broderick, thank you so much for taking the time out of your schedule to be with us here today. Thank you.
Safe drive, and thank you again to Tesla, and thank you for Mayo Clinic for making my time available today.
Thank you.
Want to say a few words to sign off?
Yeah. All right, team. We're going to sign off right now just for a few minutes, and we'll be back on the road probably in about 20 to 30 minutes.